Hi, this is Dr. Patty Gilbaugh from Gracie May Advocate Center. Today's topic is about self-harm behaviors. We're going to talk about a really difficult conversation to have with people that you care about. It's challenging, but it's important to know not all self-harm behavior is about suicide. And most of the time, it's actually not about attention seeking either. So we're going to talk about how to know the difference and what to do about it when it's serious. Self-injury is something that happens when you purposely or intentionally cause harm physically to your body. There are so many reasons why people might self-injure, but let's just look at a few of them. One might be to escape unbearable anguish. Trauma is a real concern when it comes to self-injury. People who struggle with traumatic events and recovering from those can feel a lot of anger and an overwhelming sense of frustration. And so that self-injury becomes something that maybe they take it out on themselves instead of taking it out on other people. Another reason might be to change the behavior of others, or to escape a situation, or to show desperation to other people, revenge, or to get back at other people, to gain relief from tension, or to seek help. Those are some of the common reasons for self-injury. Now let's talk about what's happening inside the brain. When somebody self-injures, or even injures in general, the brain sends out messages to the body saying, "Help me, I need some protection here." And so the body sends out hormones, norepinephrine and maybe cortisol and adrenaline sometimes, and they surge through the body to get to the rescued site where there's help needed. When the brain does that, it sends out these messages and it gives the body a sense of relief. It kind of numbs or dulls the sense of pain for the time being. When the pain stops, the brain shuts those messages down. Somebody who is really struggling can actually become addicted to that sense of relief, so they continue to self-harm. It's important to note when you're trying to help somebody who is self-injuring or self-harming, not to take that self-harm behavior completely away in the beginning. That is for a professional to help you with. So how can you help someone? What can you do? Well, we have some tips for you. One is recognize first that self-injury is usually a symptom of serious psychological distress. There's usually something going on either within the person or within the brain that makes it much more likely for them to continue self-harming. Avoid any negative reactions to the self-injury. Try hard not to focus on the behavior itself, but focus more on the pain or the emotional presence of that person. Discuss the situation calmly. When you stay calm, they're more likely to stay calm too. And focus on ways to stop the distress, but not necessarily the injury. The injury can be distressful, but remember, the injury is the symptom here. What we don't want you to do, we do not want you to focus on stopping self-injury. We want you to focus more on getting the help that somebody needs to stop the emotional pain. What we don't want you to do is to trivialize the feelings or the situations that led to self-injury. Certainly, we do not want you to punish the person, and we don't want you to threaten to withdraw care. Those are things that we know can create more harm to the person that you're trying to help. When it becomes a medical emergency, though, we want you to take appropriate action. There are times when someone has done too much self-harm, and we need to get them to a medical provider as soon as possible. So this would be when they've taken an overdose of medication, or they've consumed poison, or they've sustained a life injury, or they're confused, disoriented, or unconscious. And definitely if they're actively bleeding, especially if it's rapid or pulsing. Call 911 and give all the appropriate responses to help the person get the medical treatment that they need right away. The medical treatment is much more important than any kind of a mental health intervention we could provide at that time. If you have any questions, you can call the National Suicide Prevention Hotline You can also call our office and ask to consult with a provider. That's all we have for today, and thanks for joining us.